Okay, this is for peg tube feeding or through the nose feeding tube feeding, but we're going to use this the little stomach with a little peg tube inside of it. And PEG stands for percutaneous endoscopic gastrotomy, if you really want to know. And all this information can be found in your fundamentals book. The main thing that you will be needing is your stethoscope, your tube feeding, your extra water, gloves, and of course you're going to be checking the order before you go in about what amount and what type of feeding that you're going to be giving and how much water you're going to be giving, and also you need to know what amount of residual you can have left in the stomach. So those are the kind of things you need. When you go in with your patient, you're going to foam in and you're going to be putting on gloves, and it's not a sterile procedure, but it is a clean procedure, and you don't want anything from the patient to get all over your hands, so you be sure to put on your gloves. You will already have your tube feeding, your water all ready to go, and with the patient, and you're set up with your big syringe. Well, it should already be in the room. There's various, how often do you change out the syringe and get a different one and a new one? Depends on your institution. So some do it once a day, once a week, never. So it all depends on your institution. So when you go in, your patient should be setting up in bed at a 30-degree angle, and that is mainly for prevention of aspiration. So you always want the head of the bed up with your patient. And you go in and you assess and look at their tummy, make sure the tummy is soft, and you're going to be checking for residual and checking for placement. So the way that is, and you always, how often do you do a check for placement? Every time you put something in the tube and you check for placement. If you leave the room and you come back in, you check for placement again. So you always check for placement. So the first thing we're going to do is check for placement. So you have your stethoscope and you have your big syringe. You're going to pull back on some air. And this one has two openings for where you can place the syringe. It's just that type of tube that we bought that we put in. And you're going to put your syringe in here, and you're going to pull back 20-30 mils of air. I go about halfway, whatever that is. And put your stethoscope here, and you hold on to that, and you go whoosh, and you should hear gurgles. And don't take out the syringe yet. Now you're going to check for residual. Do it all at one motion, and you shouldn't get any or very little fluid back. If you get more than usually 150, 200, depends on your doctor's order, you don't feed. So it depends on what your order is. Standard is about 150, and you place any residual back into the stomach, and you take out your syringe, and you clamp again or put the stopper back in again, whatever kind of thing you have, because the next thing you're going to feed, so you got to pull out your plunger, and then you're going to get ready to feed. You kink a little, and you put your syringe back in, and this is sort of hard to hold on these, so you have to be very careful. So you have your formula. You're going to put your formula in, and try not to dribble like I did. You put your formula in, and then you let it in and let it go down. You have your extra water ready to go, and try to do it before it all goes through the tube. And you put your extra water in, then you kink. And the reason you kink is you try not to give any more air than you have to, because too much air is a little makes the tummy expand. So that is the feeding. That's your intermittent feeding. If you have a bag that you're going to hook up to a feeding tube machine, feeding bag machine, looks like this, and you're going to date and time it, because it's only good for 24 hours. So you want to make sure you have the date and time on, And you try not to put any more feeding in that will set in the bag more than 4 hours. And the reason for that is the tube feeding is very rich in nutrients and little bugs will grow. So you don't want to put 24 hours worth of tube feeding in the bag, because then you have lots of bugs growing and it would not be good for the patient. So one thing your book says that we have not heard before, and I asked the other instructors, is that you're to use sterile water. I've never heard that before. You can use tap water. The reason the book gives is because of microorganisms growing, but that's what we eat and drink. So it didn't really make sense. So tap water is fine unless your institution says different. Checking for placement, you can use pH strips with a little dab, a drop on a pH strip, make sure it's in the stomach. But again, we don't have those here in Enid. That is the best, but I've not seen it yet. So those are the other things. But you always want to check for placement because potential for aspiration. You always want to check for residual because you want to make sure the stomach is moving the food through the GI tract. So you always want to make sure about that. Again, on the bag, you always want to date and time it because it needs to be thrown away once every 24 hours. On the plungers and this institution, some recycle, keep them for a week, a month, depends on your institution. One thing you do every day and every time on every shift is you're going to be checking on your assessment. You're going to be checking the stomach. Is it hard, soft? You're going to be listening to make sure you're hearing vowel sounds. You're going to be checking around where the insertion site of the tube is on the stomach. Make sure it's not red, inflamed, oozing, pus, whatever. Keep it clean, soap and water, saline to remove any crusties or anything like that. You'll always want to watch for any complications, such as the GI tract not having bowel sounds, the stomach being hard, that means nauseated or having diarrhea. Those are all complications with the tube feeding. Listening to the lungs, making sure you don't hear any bad sounds, any crackles, any wheezing, because that could mean that he is aspirated. Always I&O, how much you put in and how much he's urinated, because you don't want to overload him on fluids. And also mouth care, big thing. They are not using their mouth for swallowing. Spit, saliva will clog up and accumulate in their mouth, so they need good mouth care. Their mouth is going to get dry. They're going to be breathing through their mouth a lot, and they need really good mouth care. And you need to check and make sure that the saliva has not coagulated in their mouth. Let's see. And also, make sure their head of the bed is elevated. Don't want them to aspirate. So 30 degrees, they always need to be up at 30 degrees to prevent aspiration. So, and that is all. Thank you.